in a higher dose of 40 mg. Follow-up was done for 24 months. Prior to and after the treatment, blockage volume was measured with the help of a special technique during angiography. Next. Coming to the results of this study, see the result, it is very clear. In 78% of patients, there is significant reduction in the blockage volume. This trauma volume means blockage volume in the most disease segment of 10 millimeter, to the tune of 20% also, which is a significant finding. Next. Another fact which was seen during this study was that reduction in heart vessel blockage was more when bad cholesterol level, LDL level fell down to less than 60 milligram. So, lowering down of bad cholesterol level or LDL level is the most important part of medical treatment for significant reduction in heart vessel blockage. This fact was also proved by this study. Next. Coming to next study, COURAGE study. This study proved that in patients of chronic stable angina, angioplasty or bypass surgery gives no extra benefit compared to medical treatment. In this study, nearly 2,000 patients of chronic stable angina were taken. Chronic stable angina, I already told you, patients who have same type of chest pain often on over longer duration of time, like 1 month, 2 months, 3 months, even more than 3 months. These types of patients were taken from 50 centers of America and Canada. Half of these patients were subjected to angioplasty and medical treatment both, and half of the patients were subjected to medical treatment alone. Follow-up was done for 4.6 years. During the follow-up, parameters like future heart attack rate, death rate, stroke rate, hospital admission rates were observed. Next. Coming to the results of this study, it is very clear that parameters like future heart attack rate, death rate, stroke rate were almost similar in both the groups. It was 20% in surgical group, it was 19.5% in medical treatment group. The results in medical treatment group were somewhat better, although not statistically significant. Therefore, this is the reason medical treatment has been recommended as first line of treatment in chronic stable angina patients. Angioplasty bypass surgery is recommended only when medical treatment fails. So, this study is a turning point in medical history for treatment of heart vessel blockage patients. Next. Coming to next study, PROVE-IT study. This study proved that in unstable angina patients, medical treatment with high dose anti-cholesterol medicine controls chest pain and stabilizes patients very fast and reduces the need for angioplasty very significantly. In this study, nearly 4,000 patients of unstable angina were taken. Unstable angina, I already told you, patients who have more severe and more frequent chest pain over shorter duration of time, like few hours to few days only. All these patients were taken during this study. Half of these patients were given anti-cholesterol medicine called atorvastatin in a higher dose of 80 mg, and half of the patients were given anti-cholesterol medicine called pravastatin in standard dose of